Hi everyone, Dr. Louisa here, and you're welcome to today's special Father's Day edition of our podcast. So today we're having a very honest and important conversation about men. We're going to be talking about their health, their strength, and then the things that they often keep silent about. And as we celebrate our fathers and, the father figures in our lives, we also want to focus on something that is rarely discussed, but tends to deeply affect the confidence of men, relationships, and even family life. And this is men's sexual health. For many men, topics like erectile dysfunction and low libido and even fertility challenges are difficult to talk about. But as you would know, silence it will not solve anything. Understanding, awareness, and then the right guidance is the best way to go. So in today's episode, we'll be speaking with a urologist, Dr. Amma from Kolebu Teaching Hospital, who will help us to understand the medical side of men's sexual health. And then we also have Frank here with us, who is also a pharmacist, who will introduce us to a supportive product that's called ManUp, which is designed to support men who are dealing with issues like erectile dysfunction, low libido, and sperm health. And this is not just a medical discussion, I must say. It's about to be a conversation about confidence, about masculinity, relationships, and really the importance of men taking their health seriously. So whether you are a father or you are becoming one, or you are simply interested in better understanding men's health, then this conversation is going to be very interesting for you. So please stay tuned and join us. Thank you very much, Doc, and Frank for joining us today. Father's Day is just around the corner.
Mm-hmm. We are happy.
Yes. I was having a conversation with Doc earlier. He was saying that the men don't usually get to be celebrated. So this year, they are taking the Father's Day seriously, just like how we do for Mother's Day.
Yeah.
But I think this is one of the ways that we can also appreciate the men by discussing some of the things that are difficult to talk about. And Doc, I'll start with you on using this occasion of Father's Day to discuss men's sexual health. Why do you think this is such an important topic, and why do you think it's so difficult to talk about? Why is it something that men tend to shy away from?
Yes, so for men, sexuality is masculinity. Yes, you can imagine a man who is unable to perform at home. Yes, you find some of them very depressed because of that. Secondly, their women are likely to give them some vibes that, or some attitudes that they may not be able to understand. So it's a form of huge stress for men if you have issues with their sexual health. So I think that addressing it is very important, at least, so we can celebrate Father's Day
in peace.
In peace, of course, in peace.
So, Doc, from your experience, you've been a urologist for many years. What are some of the common sexual health issues that men tend to face?
So mainly two of them, erectile dysfunction and then premature ejaculation. These are the commonest ones that you see. There's the myth that the longer you stay having sex, the better it is. It's a myth because not really the case.
Right.
So people think that they would have to stay on for a very long time. So if they ejaculate much faster to their belief, it's quite a distressing situation for them. You find them in the hospital a lot.
So, Doc, what exactly causes erectile dysfunction?
So there's this adage that we start using that, you see, erection is a man and a man is erection. In fact, your erection is the gateway to your body. So you have a lot of money, it will show in your erection.
Really?
If you don't have money, it will show in your erection.
Wow.
If you are poor, it will show in your erection. If you are happy, it will show in. If you are angry, it will show in your erection. So in fact, erection is a gateway to a man. So if a man is not getting erection, definitely there's something happening to the person's body. So we say that erection encompasses a lot of things. There's blood vessels involved. There are nerves involved. There's the brain itself involved. There's a psychological part of it also involved. And then to any disease that will affect the brain, any disease that will affect nerves, any disease that will affect vessels would also affect your sexual health. Commonest, hypertension and diabetes. These two, yes. So anytime anybody you feel that you are not getting erection, something is happening in your body. It's just a gateway, just an expression of what is happening in your body. So if you are not getting erection, there's something happening. You need to find out what it is. Yes.
But I mean, we also hear about things like stress and lifestyle, pressure from work and all of those things. How do they affect the sexual performance of men?
Yes, so if you are stressed, as I said, whatever happens to a man, it will show up in your erection. So if there's so much stress at work, it means your libido will come down because the hormones that are involved in erection are all distorted. So that will make your erection also come down. So as I said, if you are rich and you are happy, it will show in your erection. If you are poor, no money, and you are stressed, thinking about it, it will show in your erection. That's what I'm saying. So erection is actually a man, and a man is erection. To put it, yes, in a simple term.
Okay. Then now we have the conversation about fertility. And in this part of the world, the fertility issues are usually pushed to the woman.
Yeah.
Even though we know that it could also come from the man. And some people also tend to liken fertility to masculinity.
Yes.
So how common is low sperm count? And I mean, you are in the clinic, you are the one seeing it firsthand. How common is it? And, what's the effect that it's having? What are the truths that people should really know about that?
In fact, in the literature, we say that it's 30% woman, 30% man, 40% unknown, and then the rest is both. But
society gives about 90% to the woman.
Yes, but you see, from the data that we are collecting now, we are realizing that the thing is far more common than we think. Now, there was even a colleague who even said that about 2/3 of the causes of infertility are from men.
Wow.
Yes, so for a very long time, the whole issue of the man's health is something that had been relegated.
That's true.
We didn't pay too much attention to that. And we came back to it just recently to realize that a man is actually, the reproductive organ of a man is actually very complex and involves a lot of things. So I would say that's very common, and more than 50% of the time, the cause of infertility is from the man and not from the woman.
Wow.
More than 50% of the time. More common than you may even think of. In fact, I just looked at the data that I have on couples who come for infertility, and you realize that you are getting almost about 60-65% of the reasons why couples come to hospital for infertility to be male factor infertility.
Wow.
Yes, and these are very complex causes. Causes are quite complex, more difficult because we have not researched into it for a very long time. Understanding is poor, and that's where we are.
Wow. So, I mean, even though you've mentioned that the causes for some of these things like low sperm count are a bit complex, basics, what are, vaguely, what would you say could be some of the causes?
One, genital infections.
Okay.
So people who've had genital infections before, gonorrhea, syphilis, and the rest, genital infection. So those are very common. Then we have what we call oxidative oxygen or this species. So those are things that affect let me put it this way. The whole formation of sperm is within an inert environment. So what it means is that it's not exposed to the rest of the body.
Right.
So anything that will make it exposed to the body will affect the sperm production.
Okay.
So the commonest one is infections.
Okay.
People are also born with all sorts of problems that are not taken care of. For example, people are born with their testes not descended. And then there's this myth around that, it will come down when the person goes, or may even not be aware. In fact, we had one case of a 39-year-old man who even didn't know that the testes were still not descended.
Wow.
And had been married for 5 years. The wife also didn't know that the testes had been undescended, yes. and they weren't having babies, only to come to hospital for us to realize that the testes were undescended. So undescended testes, very common, very common. People also get what we call testicular torsion. You may be walking around and then the testis will twist on itself. You get this sharp pain in the testis, and then somebody gives you antibiotics. That's the end of the testis, and then they come and they are not producing. And this is very common. Even in the clinic, every week you may find one. You may find one every week. So you can imagine what is happening. Even in a tertiary hospital, if you are finding that, you can imagine what is happening in the rest of the society.
Yes.
Very common. And they come and then there's no testis being produced. So these are some of the things that could cause low sperm count.
So that means that there is an increasing need for men to go and see a urologist whenever they notice something is wrong, because you've mentioned genital infections. I'm sure that there are definitely symptoms that come with them, but sometimes they, for fear of being judged, they may not want to share with their partner or, go to the hospital for people to know that this is a battle they are facing. They are talking about the testicular torsion, which is an indication will be extreme pain in the testis, and then they go and take a painkiller. But the problem is still there.
It will still be there.
So what would you say would be some indications that one should base on to go and see a urologist?
So I'll say that let's start from the erectile dysfunction. Okay. Once you realize you are not getting erection, don't sit at home and think that it's just the erection that is happening. It's always an indication that something is happening in your body. So once you see that, just go to the hospital and see a urologist to evaluate you to find out what it is. Because most of the time, some of these things are reversible. It can be reversed. Then 2, if you are a man and you feel that you have any pain in your testis, don't sit at home. Come and let's evaluate you to find out what it is. So some of these things are very important that you should. Then if you realize that you are seeing some discharge from your penis, don't sit at home because it's a sign of infection. If you realize that you are urinating more often than you used to urinate, especially when you go to sleep, and you have to wake up 3-4 times to go and urinate, that is not normal. You would have to see a urologist to help you out. If you see any swelling anywhere around your genitals, please see the doctor for us to help. So these are very simple ones, especially the biggest one. If you see any blood in your urine, don't sit at home. Always come to the hospital for us to look at it. It might be something.
Right. Okay. Thank you very much for sharing that. Now, when it comes to these sexual problems, we've spoken about more of the physical issues internally and all of that. Is there any psychological component that tends to affect sexual health in men?
Yes, a lot. So let me use this as an example. You may have somebody who is very sexually active, believes in himself a lot. Then he gets married. Then on the wedding day, honeymoon day, for one reason or the other, the performance is not very good. This is practical. Then the woman makes a comment that shows that the guy didn't do well on that day. And that's the end of the story.
Oh, no.
Yes. I mean, I've seen one that has ended up in divorce.
Oh, wow.
Because the man just lost his confidence.
Wow.
And anytime he tries to approach the woman, he's just afraid that he may not do well. And it's like prophecy. Once you are afraid that you will not do well, you surely will not do well. And so you realize that it becomes a cycle. You are afraid, you don't do well, you get worried, you are more afraid, you don't do well. So eventually they lose interest in the whole episode of sexuality, and that affects them.
So, Doc, in such a case where the psychological factors are playing much of a bigger role, what would you recommend for such people?
If you don't find a way to break the cycle, it will go on and on and on and on. And this eats very deeply into the man's confidence. Very, very deeply into the man's confidence, yes. So if you see a urologist, we go into the history and realize that these are some of the issues. Then we can take it one by one to try and resolve it. If it's communication, we try and resolve it. If it's treatment at home, we try and resolve it. And to try and break that cycle, or else it will go on and on and on and on. And I've seen one that's ended up in divorce.
Wow.
Yeah.
So, Doc, I mean, in this area of fertility, men's sexual health, and all that, there are so many myths that we hear about.
Yeah.
Given the chance now, what are some of the myths that you would immediately want to debunk for our people? Because, sometimes some of these things are very hard to erase from their minds because they've heard it over and over again.
There's this research that was done. The question was whether women are actually interested in the size of the penis of their partners. Very interesting. It turned out that 85% of men are worried about the size of their penis, but the women are actually not bothered at all.
That's interesting.
Yes, not bothered at all. And this is one big issue for men. The size of your penis is actually a sign of your masculinity. So men are very, very particular about the size of their penis. But the other partner is just not bothered.
So this is actually backed by research.
Yes.
Wow.
Number 2, you can never ever determine the size of a penis when it is flaccid. No. So the small penis you find when it's flaccid expands when it's erect. So when we're in school, you may see somebody say, hey, this guy is huge. What you see will be the same if he erects. Nothing adds to it. Then there's another person, very small, you'll be laughing at them, but when he erects, it's just like the big one that you have seen. So men should not be worried about the size of the, because the size of the penises are relatively the same. The differences are very small.
I see.
So that's one myth. So it is not. I remember there was an advert that is not about the size, but the way you. There's an advert like that. So men shouldn't be worried too much about the size of their penises. That's one myth.
Wow.
Yes, that's one myth. Yes. Then we watch movies and we realize that you can have sexual intercourse for an hour, sexual intercourse for 2 hours. No. It never happens in real life. 3, it is not about how long you are able to stay. Say, we stayed on for 30 minutes. For today, I met somebody who was worried that he stays on for 15, 20 minutes. And he's worried. So he has come to hospital. We has premature ejaculation. Normal sexual intercourse should not last more than 5 minutes. 5-10 minutes.
Everybody's face has changed in the studio.
5-10 minutes, you are finished.
Wow.
So it is not possible for you to stay on trusting for 1 hour or 2 hours. No. So that's a bit. So it's not possible. It's only found in movies, not in real life. Yes. So these are some of the measures. Then these people come with they say, we have premature ejaculation. Then you ask them and then, say 30 minutes. And the person is still saying that he wants to stay more. You can't stay more than that.
They want to go for the 2 hours they've been seeing.
Yes. It's found in movies. It's not real. It's not real. Then the next myth is that somebody comes and says that, I go on round 1 and then I have to wait small before I go to round 2. Yes, you have to. Sure, you have to wait small. Maybe when you are younger, the latent phase will be shorter, but as you grow, the latent phase will be. So you find a 60-year-old man who comes and says that when I have sex with my wife, I have to wait maybe at 9 p.m. I have to wait till 12 midnight before I can erect again. That is cool. For a younger person, you don't have to wait that long, but as you age, you may have to wait that long. And I believe that it's not about the number of times. It's about getting to orgasm for both. So once both are satisfied, that is what, because when we are defining erectile dysfunction, premature ejaculation, we are saying that you stay long enough to satisfy both partners. So long as both partners are satisfied, that is okay. So it's not about the number of times, as we put it, the number of rounds that you go. It's not. That is not. That is not the issue. So that's another myth. It's not necessarily the number of times you go, but how well you go that both partners are satisfied. Yeah. Then the issue of atadre and atadre contains a lot of zinc. You find zinc a lot in sperms and the rest. So we say that if you take in atadre, it means you are charging your battery.
That's tiger nuts.
Tiger nuts. You are charging your battery. There's no battery to charge. You're not charging your battery. So I'm not saying tiger nuts is not good. It's very good. Contains a lot of zinc, and you find zinc in our body doing all sorts of things. So tiger nuts, very good. If you chew, very good. But we are not saying that it is charging your battery to be able to erect more, have sexual intercourse longer. So those are some of the myths I want to debunk. Yeah.
Thank you, Doc, for sharing these myths and debunking them for us instantly. There are also issues from Frank. I think I'll come to you on that. We see a lot of advertisements now, especially now that we have social media, of all sorts of herbal preparations on the markets that people are marketing. Like Doc is saying, atadre, tiger nuts concoctions that are being made with all other ingredients and all of that. How efficient are these preparations in helping men with sexual health problems?
Yeah, so for those that are advertised, one of the challenges that we've seen is that their marketing claims or their indications are over exaggerated. So because they are exaggerated, the expectation of people who go and buy are not met because it's not realistic.
Yeah.
For instance, typically they will advertise that it increases the size of your penis. And I'm happy that the urologists address that issue. So because they know that men are so much crazy about the size of the penis, they put that as a marketing gimmick just to get people to buy.
Right.
And then they talk about how long, because most men are concerned about how long they are able to have the sexual intercourse experience. And that's a big issue with men. The more rounds, the better. So they exaggerate and say, okay, it can go 1 hour, 2 hours, which is something that the men are already in their mind perceiving to be the best sexual experience. So this is just to let you, and then they tell you that there's no side effects, which is also not true, because the fact that it's herbal based does not mean it doesn't have a side effect. That's another big misinformation out there. Every medication, whether it is herbal, has side effect because as it's taken in the body, it alters the body's natural physiological process, and by so doing, there will be some side effects along the line. So that is also something that is also not true. And then some of them are also adulterated. You'd be surprised that they say it's natural, it's herbal based, but when I remember FDA did some soup on the market, they picked some random samples of so-called herbal medications for erectile dysfunction and sexual health boosting, aphrodisiac and the like. And they discovered that some of them contain allopathic medicine like sildenafil and the rest. Something that's supposed to be herbal. So that's also another big, problem out there, adulteration. And then some of them too are not registered. And so, when the product is registered by the FDA, they've done the safety studies and made sure that the product is safe for public consumption. So if it's not registered, then what are you trying to hide? And then some of them too, in an attempt to copy one that is authentic, they add certain ingredients as if they want to, make it more superior. In an attempt to make it more enhanced, they add certain ingredients that are not compatible and not suitable for, the body. So a fake product is also something that is a big problem out there. The product is fake. I mean, it's not. It contains something totally different from what it states in the
in the packaging and in the marketing.
Exactly. So another thing too is that sometimes the dosage is also not very clear.
Right.
I mean, they will tell you, take 2 before the match, and you don't know whether it is for an instant performance. I mean, the same medication is indicated for both growth of the penis. I mean, there are so many. One medicine is doing everything. It's not true. The dosing too is sometimes very, very odd. You can take 1 and also sometimes take 3. I mean, it's not very clear. And you see, the difference between a medicine and a poison is the dosage.
Right.
So if you go above the stipulated dosage, then it tends to be a poison. So because of these issues, we are recording a lot of kidney problems, liver problems and all that because of dosage issues, fake medicines, unregistered medicines and all that. So this is for us to know that when it comes to medication, you have to see your health professional, a doctor, to recommend the medication for you. Very, very important, because the symptom you are having can be a sign of another problem. The urologist told us that the fact that you have erectile dysfunction symptoms may be a sign of other bigger issues out there, which when they run the labs, they'll be able to pick out. So, he said that erectile dysfunction can be a symptom of hypertension or cardiovascular disease. So, if you are just managing the symptom, you've not done yourself any good. So, the health professional is able to go deeper and give you the right diagnosis.
Right.
Yeah.
So, on the back of that conversation, let's talk about ManUp. So, ManUp is, I know you tell us more about it because you know more about the product, but it's a product that we discussed on our last episode where we spoke about men's health. And the reviews that I got in my inbox, I was amazed. People were talking about how they used it, how it has helped them, and where can they find it. Some of them are saying, I can't find it anymore. Is it still being produced? And I said, wow, okay, I didn't know myself. I didn't really know much about it until after the podcast. So I said, wow, this must be, a magic drug that these men are all, falling for. Tell us about ManUp. And I think one of the main things that a lot of people liked about the products is the fact that it has some natural ingredients. And I think you also mentioned natural ingredients being one of the motivations that people will go out and buy these herbal preparations, which eventually are not regulated by FDA and may also contain some other constituents or be adulterated. So tell us about this ManUp.
Yes, thank you very much. ManUp is one of the products that belong to the range of the Hollywood Nutrition's umbrella of products.
Okay.
Luex Pharmaceuticals or Unichem, we deal with both natural or natural-based supplements as well as the allopathic medications, which is, we call it orthodox medication. So for ManUp, it is a natural-based formulation, scientifically, formulated, produced under very high-quality manufacturing facility in the U.S., and the ingredients are carefully selected such that they are very safe, and then they give very minimal side effects, and they are also very efficacious. Now, if you take ManUp, it has 60 capsules. And then I say that ManUp has been formulated with 6 unique ingredients. And these 6 unique ingredients, when I am talking about how it's meaning the makeup of it, I always use the 3-2-1 formation. You know, we Ghanaians, we are football enthusiasts. So if I use the football formation, setup, it will help us to understand the ingredients better. So for instance, 3-2-1 formation, if you're going to play any football match, which we liken sexual intercourse to be a football match, typically a man will say, "Do they have a match?" And that term match means that he's going to have sex with his spouse or his girlfriend or something. So how do we win the match with ManUp? Okay, so now ManUp, the 3, I call them the attackers. There are 3 ingredients basically meant to help improve blood supply to the penile region, and they are vasodilators. So one is L-arginine. L-arginine is an amino acid, essential amino acid. You can get it from your diet, meat, poultry, and all that. But this one is extracted for you to get high amounts of it in its pure form. L-arginine increases the levels of nitric oxide, and we have the amount as 250 milligram. Now, I mentioned the amount because some formulation may have the same ingredient, but the amount might be lesser, and then the purity of that ingredient might not be that high. So pure amounts of L-arginine, and also it has 250 milligram, per 1 capsule. So I said it boosts nitric oxide levels, which is very important to dilate the blood vessels and increase blood supply to the penile region for you to have, harder erections, a more sustained erection. And there is something that we always say that improving blood flow to the penile region by improving the erection, what it does is that it makes you achieve your maximum erectile length and girth. It's not actually going to add any extra tissue to what you already have, but there is an optimum or a maximum erection girth and length that you are supposed to have. The more blood supply and the more the vasodilatation, you are able to achieve that optimum, girth and length of the penis. So it will appear as if the penis has become bigger, but you've actually achieved your maximum length and girth with the improvement in blood supply to the penile region. So L-arginine does that for you. And then I talked about the erection hardness and all that. Now, it also contains, the ginseng, 125 milligram per capsule. And, the ginseng is a common ingredient found in other formulations, but the thing is, the source of the ginseng is as important as what you are putting in. So we have the Panax ginseng, which is quite common, but we also have the Panax acacifolia, which is from American origin. Panax ginseng mostly comes from Korea, but we've also added the ginseng species from the US. So you could see that it gives it a synergistic extra benefit by boosting the testosterone levels and also improving nitric oxide production. Now, nitric oxide production normally declines as you age. And so this is a corrective measure to be able to improve that. The more nitric oxide you're able to produce, the better your erection. So it's also increasing blood supply to the penile region to improve the hardness of the erection, and then makes the erection last longer. Testosterone, as you know, as you begin to grow, the testosterone level declines. So you are restoring that level that is declining in the body. You have your cayenne pepper, which is also a vasodilator. And, pepper has a way of dilating the blood vessels generally. So it improves general circulation. In addition to that, it ensures that the small capillaries and vessels are dilated very well, including the vessels in the penile region, to improve erection hardness and then stability of the erection as well. So these are 3 vasodilators, and it is very, very powerful. It works very safe. Then you come to your midfielders, the 2. They are the midfielders. They are there to improve semen volume, sperm count, and sperm motility. So the quality of your sperm is also greatly improved and enhanced with ManUp. So what are the ingredients? We look at Tonkat Ali, 400 milligram per one in the capsule. And the job of Tonkat Ali is to improve, as I said, the semen volume, sperm count, and then the sperm motility, to make sure that the quality of your sperm is greatly boosted and enhanced. It's not just producing sperm, but the semen, but the amount of the viable sperms in it, the motility of the sperm is very, very important. So ManUp is doing that for you. And there is also Maca, 250 milligram, which also gives you energy and stamina. The sexual experience requires a lot of energy and stamina, So that is why, somebody said I went for 3 rounds and I was exhausted, because you expend a lot of energy. So it gives you the energy and the stamina to be able to have a more satisfactory sexual experience, especially when you age, the energy levels decline. So you need a lot of stamina. I know of men, some of the old men who have collapsed after a sexual encounter, but lack of energy is one of them. Some don't even have the energy. They tell their wives that today I am tired. So it tells you that there's a challenge out there with energy and stamina when it comes to sexual experience. So your Maca is doing that for you. And also the Tongat Ali also gives you that energy and stamina as well. So your sperm count, quality, and all that is being boosted, which my senior man, the urologist, has said that male fertility is a big challenge. People are even beginning to do DNA tests. It's an indirect way to find out whether the child belongs to you or not. So it's an indirect infertility twist.
Check.
Indirect. So if you do your DNA test and then you must also go and do your semen analysis, see your urologist to be sure that the problem is not coming for you. Now that I think we are having documented, evidence to show that majority of the infertility cases, men are the cause, we need to take care and make sure that our sperm quality and the count is up to the mark. And ManUp is going to do that for you. Now, the last, which I would say is a defender. Defenders are important to make sure that you don't lose matches. There's no point in scoring so much and also conceding so much. So libido. Libido is actually the driver of the sexual experience. It starts the tone. So you must be in the mood, have the drive before the others can come into play. So your Katuaba back powder is also in there in the ManUp, and the job is to boost your libido by helping in the release of dopamine, which is a feel-good hormone that helps you to give you the mood. It will surprise you that people think men are always in the mood, but it's not true. There are so many things that can take you out of the mood. As my brother said, relationship challenges, maybe a comment your wife, made. Are you a man? Look at the chop money you are putting. These things, it kills the ego of the man. And psychologically, once anything that affects your psychological status, it also affects some hormone secretion, particularly the dopamine. So a lot of depression, overwork and all that. So anything that disturbs the mental state of the man will definitely affect the libido. So we know that in this world where there's so much responsibility on a man, in fact, a woman will say that I will not marry any man who doesn't make 6 figures. They make all kinds of expectations. So after the marriage, there's a lot of pressure on men, and so if they are not able to meet the high demands of their wives or girlfriends, it becomes a challenge. And these things will really bring down your libido. So libido boosting is very, very important. It's almost like the salt in a meal. Without it, everything is so insipid and tasteless. So you need the libido, and the libido should be up there. Now, so ManUp is giving you all these properties, the 3 key properties, boosting your erection and making sure that you perform to satisfy your partner, and also making sure that your self-esteem and your confidence as a man is not eroded, and also making sure that at any point in time you can be proud that these are your children, and not be thinking that, Charlie, am I this guy looks like me, is it me? Or it takes away that, keeps you mentally safe from there. And then your sexual drive is always up there, which is very, very important, because you see, after making all the money, you shouldn't also this is something for you to enjoy. God gave us sex also as to enjoy, not also only to produce babies. So you need to also enjoy yourself. So ManUp, as I said, you're having all these important and powerful benefits in one formulation. But of course, I said there's no formulation that doesn't have any side effects. And of course, sometimes when people take the ManUp, very few patients talk about some headaches, because of the increase in the blood, circulation. Sometimes when they are taking some foods, for instance, there are some foods that also have some vasodilatory effect, like garlic and the rest. So sometimes that combined effect can actually give you some unwanted, side effects, which are tolerable, because it doesn't last. And most of them will tell you that, when I started, some few headaches, but it went away when I continued. And then some of them will tell you that sometimes the erection comes when they don't really plan for it, which is also something that might be a plus to some too might not. Because probably the person is preaching and something happens. So it some may like it, some too may say, no, this one not here. Wait till I get to. And because it's a supplement, the dosage is, you can take it 1 capsule twice a day, or you can take it 2 capsules once a day. Now, I always say that just to prevent you from forgetting, just take the 2 capsules once a day after meals. And ManUp is also very, very safe for patients who have been diagnosed with erectile dysfunction. I say that because erectile dysfunction is diagnosed by a doctor. If you have a urologist, perfect. We don't want people to self-diagnose themselves. Because as I said, what you are seeing there might be more issues. So as much as possible, get your diagnosis right, see a doctor for the diagnosis. Then you can now use ManUp to help you with the management. And of course, the doctor also has other therapies based on his assessment. But ManUp is one of the key therapies that we are normally recommended by doctors, particularly urology. We've been working with urologists for a long time. They've recommended the ManUp, they prescribe it. That should tell you the confidence that ManUp has among specialists. So you are very safe with ManUp, and the old people too are not left out. Don't be afraid that if you take the ManUp, it will drive you to overperform and for you to have a heart. No, it's not like that. It's not a performance enhancing supplement. It is a dietary supplement, which is not something as a quick fix. These ingredients I mentioned, when you take it over time, as according to the dosage, it helps you to be able to correct the damages in your body, particularly due to oxidative stress and some other, circulatory issues. So with along the line, it helps you to improve such that you probably may not have to be taking it continuously, and there might be a period even without it, your body can just pick it up from there. ManUp has come to stay, and then I would encourage everyone out there that if you are looking for a medication that is trusted and safe, ManUp is the go-to. And of course, I will tell you that before you buy it, seek pharmacist, doctor, and then they would give you, the directions. And don't forget that medications doesn't solve all the problems. There are other, lifestyle, counseling that you have to go through, and that is the benefit from seeing a doctor or a pharmacist. We are not only here to sell medications; we are here to, give you a comprehensive, well-being for your health. So that is ManUp for you, and it's very affordable. It's found in all the pharmacies across the country, so you can easily, find it in any pharmacy in your area. Just walk in there, and then you will get it. Then the price too is quite affordable. Knowing we are here to help Ghanaian men, we don't want to price it and make it like as if it's for the rich. No. Erectile dysfunction is something that affects a lot of men, and we are here to give solutions. We are not here to profit over something that a lot of people have. So solution, safe solutions, and quality medications is our hallmark as Unicare. All right, so that's where I'll end. To talk about ManUp. I spent a lot of time.
You've basically answered all the questions that I had about ManUp.
Yeah.
So you've spoken about, the fact that it has to go with some lifestyle changes. I'll come to Doc on that. What are some of the lifestyle changes that one would have to adopt when they are taking a product such as ManUp? I know you also prescribe it, and so you are very conversant with it. What are some of the lifestyle changes or lifestyle modifications that one would have to make?
Yeah, so basically, especially for erectile dysfunctions, things that will prevent you from getting diabetes, things that will prevent you from getting hypertension. So one is exercise, it's balanced diet, drink a lot of water. Then be checking your sugar regularly, check your BP regularly. If you are hypertensive, if you are diabetic rather, check your diet, see a dietitian to help you with your diet, control your sugar very well. And then if you are hypertensive, to stick to your medications. And then ManUp will do the rest of the work for you.
Wow. Okay, so my final question will come back to you, Frank. Who is the ideal person for ManUp? Is there a restriction in who can take it, who cannot take it? Is it contraindicated in certain groups of people?
Yes. So looking at those who take it, I'll say that those who have been diagnosed of erectile dysfunction, in addition to maybe it comes with some comorbidities like maybe low sperm count and then low libido. So if you are diagnosed with these conditions, yes, then you're a candidate for that. And then I would also say that since erectile dysfunction is something that comes with aging, if you are from 40 and above, what is happening to you is that your testosterone level is decreasing, but you don't see it physically. See, the effect is not really seen immediately unless you do a lab analysis. So from that age going, you need to understand that you need to have a supplement that can help your testosterone levels to be at its optimum. So you are a candidate for ManUp. As I said, it's not only for those with erectile dysfunction. It's a supplement that also boosts your sexual health. So yes, 40 and above, knowing that your oxidative stress and all that is a problem, so you need to supplement. So yes, and then those who are into certain lifestyle like smoking and drinking a lot, you see these lifestyle habits have a way of causing atherosclerosis or narrowing your blood vessels, which eventually will also decrease blood supply to your penile region. So a lot of alcohol consumption and then cigarette smoking is something that you are probably had in the past and you are trying to work on it. But aside giving you all the problems, the lung issues, your sexual health will also be greatly affected. So if you have such a history, you need to correct it with the ManUp. And I think the ManUp will help you in the long term to be able to help you reverse those damages. And, there are some people who probably have had a surgery, prostatic surgery, and maybe because of some of the complications of the surgery, every surgery has its own pluses and minuses. And so they may have to take something like ManUp to be able to help their erection. So that is a typical case like that. And if you are hypertensive and then you are on medication, and we know that some of the medications, one of the side effects is erectile dysfunction. So you need to, correct that by taking the ManUp so that as your cardiovascular health is being taken care of, you don't also lose the match in the bed, you see. And diabetics, the same, because they also, because of the condition along the line, they seem to have this erectile dysfunction issue. So taking it along with your diabetic medications, but under the supervision of a doctor, is very good. The doctor will be able to monitor to be sure that the medication and the ManUp don't have any adverse drug interaction, which is very important. So it's not contraindicated, but if you are diabetic or hypertensive, it should be under the supervision or the monitoring of a doctor. You can take it, no issues, but the doctor will be able to monitor to make sure that you don't have any interactive side effect. The last candidates would be people who, because of the medication they are taking, maybe antidepressants, probably they have some, condition that they are taking some antidepressants or some other medication, and because of the side effects of those medication, they are having this, erectile dysfunction. But you see, you cannot say you are stopping the medication, but the doctor can be able to look at the case and also recommend the ManUp so that as your is managing the condition, you don't also suffer the adverse side effects of that medication. So these are the people that are candidates for ManUp. And of course, in our fast-paced world, and energy demands are high. People are doing 3 jobs, 4 jobs just to make ends meet. It's not easy to be a man. You need the energy levels to be up there, and you need to be at peak performance, and it's not easy, So with a food supplement like this, I think it comes in handy to be able to meet the energy demands and the performance demands at the workplace and the bedroom as well. So I think that if you are somebody who is not eating very well because of they said in this economy people are doing what 0, 0, 1, 1, 0, 1 and all that.
No, that has stopped.
Well, yes, they say it has stopped, but not all fingers are not the same. There are some who, because of financial reasons, have to be doing this 0, 0 and all those things. Now it means that they are just eating carbs just to hold body and soul together. You would need these specialized ingredients that help sexual health, which you cannot find in this 0, 0 diet. So people like that would have to supplement with the ManUp. And ManUp is very safe, as I said, for such patients and these candidates who qualify. Okay, thank you.
Thank you very much, Frank. Thank you so much, Dr. Amwa, for joining me. This has been a very educative and insightful session, especially for our men, for our fathers, our father figures. I hope that you found the discussion very useful to yourself. And this is also our way of saying a very special Happy Father's Day to you. We want you to take good care of yourselves. We want you to feel confident in sharing any problems that you have and seeking for help and seeking for the help at the right place. So for myself and my guests, we say a very special Happy Father's Day to all fathers out there. Thank you so much for watching. Bye.